Direct billing. Anyone who knows me knows I have many, many thoughts and feelings about direct billing. In fact, in the last year and a half of running my business and my practice, I stopped direct billing because of all the reasons that I'm going to go through. I just didn't feel it was worth the stress, the hassle, and the responsibility of it. So that's obviously my personal opinion on it. But I do think it's really important to break down some of the reasons why direct billing isn't just a great way to save on credit card fees. There's actually a lot more to it than is, at surface level. So with that, in this episode, what I'm going to do is I would like to lay out 5 really, really important things that every clinic owner needs to understand about direct billing before hitting submit. So with that, I am going to start. So number 1, this is probably my favorite one. I know most podcasts, you should probably save your favorite one for last, but this one's just way too juicy. So number 1, the most important thing that you need to consider is the difference between scope of practice and scope of coverage. What does that mean? Just because something is in your legal scope of practice, say you're a physiotherapist or an RMT, just because your college allows you to do something does not mean that a private insurance company will cover it. So, for example, this is my favorite example because I know it intimately. Just because we legally, as physiotherapists, are allowed to use a PTSW or a physical therapy support worker, physio assistant, kinesiologist, however you want to frame it, just because legally we can by our college standard does not mean that an insurance company needs to pay for said session. Especially when it comes to private insurers, this is something that they have full autonomy in choosing. And whoever buys these programs is, it's their right to shop around and determine which insurance company they want to go with, depending on what coverage is important to them. So if an insurance company does not want to cover PTSW sessions, that is perfectly within their prerogative if they are a private insurer. It's different if it's government, that's a whole other conversation. But for the purposes of this video, we are talking private insurance. So if you provide Pilates, say, for active rehab, for, maintenance or prevention of injury, again, perfectly within our scope of practice, does not mean a private insurance company needs to pay for prevention or maintenance or wellness, right? So this whole scenario is super, super important. And one of the most challenging parts of it is every single insurance company is different. So in order to understand this, you have to go through the terms and conditions for literally every single insurer that you're planning to direct bill. So, if you want to open an account with Pacific Blue Cross, those of us in BC are very familiar with the fact that Pacific Blue Cross does not cover PTSW sessions. So if you're going to be offering that and then you direct bill Pacific Blue Cross for a session that involved a PTSW, now that they have public facing information on that, it's on you to make sure that you are direct billing for services that they actually cover. So again, you can provide that service, but you cannot direct bill for it if they do not want to cover it. So familiarizing yourself with that is really challenging. It's a lot of work. It's a lot of admin. It's a lot of time. And you have to do it for every single insurer that you're going to do. So, sometimes it's actually easier and less responsibility to have the client do that work on their own. It's really, in my opinion, I think clients need to be really familiar with their own policies, right? Having the liability and having this responsibility fall entirely on a clinic owner is really hard, right? And so, we obviously want to make sure that we're offering the best possible services for our patients, and going the extra mile and offering, direct billing is something that can be really beneficial to patients in terms of not paying out of pocket or retention. It's easier. They don't want to have to go through the process of submitting. Yeah, we're making their lives easier. And at the same time, taking on a huge amount of responsibility, especially if we're clinic owners that offer, different types of services. So PTSW or Pilates or, general wellness programs, group exercise, group classes is another huge part of this. as physios, we're able to, do group classes, and especially if we do individualized assessments and it's, we can do group physiotherapy. Again, insurance companies might not want to cover that. So direct billing for a group class or anything that's kind of in that like specialty billing zone can get really gray and cause you a lot of grief and financial and legal issues down the road if through audit this is discovered. So if you are going to provide any of these services and you're unclear, my advice is to reach out directly to the insurance company. Call Pacific Blue Cross and say, hey, do you cover Pilates? Hey, do you cover PTSW? Call these companies and find out, do your due diligence if you do plan to bill. If you want to offer that service and it's not covered, then you just have to explain to the patient that you can give them the receipt and, you can still offer the service. They can try to submit, but ultimately there's going to be a responsibility back on the patient if they decide to submit, because now it's on them to determine what the terms and conditions that they're comfortable submitting are, right? And the liability falls back on them if they decide to submit for something that you've explained to them is uncertain or unclear or is not covered by their scope of practice. So I think it's important to spread the liability and spread the responsibility amongst all stakeholders in a situation like this. So the other thing, exercise is a really big one. Physiotherapists, taking exercise away from a physio is like taking a scalpel away from a surgeon. This is what we know inside and out. And I know a lot of private insurers, especially in BC right now, have decided that exercise is not an insurable thing for physiotherapy. Again, this is a bit gray. It's different insurance company to insurance company. So the big thing that I've come to understand is it's not about not covering exercise. It's about having a necessary, clear, and very well documented medical indication and rationale for why you're doing certain exercising. Documenting in a way that looks like it's just like a workout is not going to help you on audit. So making sure that you're really clear about why you're doing something, what the indication is, and then having, really clear outcome measures pre and post to indicate when someone is going to be discharged. That's another really big thing that insurance companies look for on audit is discharge. So if you are, the patient has graduated, don't just keep seeing them for maintenance. That's something that they don't really like. So having a really clear treatment plan protocol and indicators that decide when someone is ready for, being released back into the wild, that's really, really important. So that's number one. Understanding the scope of practice and scope of coverage differences within the insurance company. If you feel really comfortable that you understand these differences, then by all means, direct bill for what's appropriate. Don't direct bill for what's not appropriate, and really familiarize yourself with that, because if you're not familiar, you could find yourself in some really hot water. And I know a lot of clinic owners did 2 years ago when Pacific Blue Cross did some mega audits. There's some questionable, aspects to whether or not it was public facing information about PTSW, but a lot of people got into some hot water because they were direct billing for something that actually wasn't covered by the insurance company. So understanding this difference is huge, and that's number one. Number two, this one is all about consent forms and client consent, client communication, and understanding. So if you are going to direct bill, you must have consent documented from the patient. You have to have a document signed by the patient that explicitly states that you are able to direct bill on their behalf. So first of all, not having that in place is a huge no-no. On audit, if that's discovered, you right off the hopper in some hot water. It's really important to have documented consent for direct billing. The next piece of this is that many of the insurance companies in British Columbia and very likely Canada and beyond, many of them have different consent forms that they require you to have signed and held on file. A generic one often doesn't work for some companies. For example, I know anything that is billed through TELUS has a specific direct billing consent form that is unique to all of their providers that are billed through their portal. Sun Life has their own, and Pacific Blue Cross has their own. I know most recently Green Shield was fine with a generic one. It just had to be on file. But if you're going to direct bill any of these providers, having documented consent, in a generic form at minimum is necessary, but making sure you have it documented for every single insurance company across the board is really important. So again, more legwork for you to download these consent forms and figure out who needs what and how you store it. Does it need to be paper? Can it be e-signed? All of these things. Super important, not clear cut, and also different for every single company. Another big piece of this too, and this is something that came up in our WhatsApp group recently, is about IDing patients. If you're having a patient sign a consent form to direct bill on their behalf, we should also probably be IDing our patients and also be making sure that the person we are direct billing on behalf of is actually the person who's standing in front of you. Not that insurance fraud of that sort is common, but at the end of the day, the clinic owner is responsible. So let's say someone poses as someone else and comes in and signs that consent form. The clinic owner is ultimately responsible. So IDing patients, getting consent, these things are really, really important to protect yourself. So making sure you think about all of these things and document them before you hit submit, huge, 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 huge. The other big piece to consent is making sure that you have consent documented for how you're going to bill the patient if the claim is rejected, denied, or if it's in pending mode. So many clinic owners use Jane. Go Jane. I love Jane. With Jane, you can store credit cards on file. But if you want to actually charge that credit card, you also must have consent from the patient. Now, this is not something that an insurance company requires or the college requires, but if you find yourself in a scenario where you charge a credit card and the patient has decided that they don't like that charge and they do a chargeback, if you don't have documented consent that you could charge their credit card for the difference or for the denied piece or for whatever, the credit card company might just side with the patient. They might just decide that, well, you didn't actually document consent to charge the credit card, so too bad. Patient gets the charge back and you're out the difference or the full amount depending on that. So not even on the direct billing side, if you're going to charge a credit card, just make sure you have consent documented that you're okay to charge a credit card, because that's also just a whole other thing. I have a whole story around it, and I'm pretty proud of myself for the fact that I had all of these consent forms because I won a pretty significant case in a credit card issue. Total aside, probably a story for another time, but document consent to charge a credit card and include that piece in your direct billing consent form as well, because if a claim is denied, indicating how you're going to process the fee in that case is also going to be essential. On the credit card piece, something else that's really important is if you have an outstanding bill and you want to collect interest on it, it's also important to have consent signed at that time for interest. So for example, if someone doesn't pay their bill and you send them an invoice and you keep sending them an invoice or whatever, in order to actually accrue interest on that, you have to give them that heads up as well. Not entirely necessary, but it holds up way better at like the Civil Resolution Tribunal or the credit card company if you ever do want to claw back and gain interest on it. That's an aside, but consent to direct bill, consent to use a credit card, or however you're going to collect payment, essential here. Yeah, kind of a bit of an aside within that, but yeah, consent. I mean, consent is the name of the game in all aspects of healthcare, but really, really essential when it comes to the finances of people, right? So with that, we will move along. So number 3, I've kind of already alluded to this, but risk and responsibility is number 3. Identifying who is responsible legally and financially when it comes to direct billing and audits is essential. In more cases than not, it is the clinic owner. So if you are a clinic owner and you get audited, you may not have done anything wrong, but perhaps something happened where one of your clinicians did something a little sketchy or made an error in good faith, and you direct billed for it. Guess what? You're on the hook as the clinic owner in most cases. I know with ICBC's terms that was the case. I know with many of the private insurers this is the case. So if you direct bill on behalf of your clinicians, you are responsible for any mistakes that they may make. You are responsible legally and financially in the case of an audit. So you might be doing everything by the book, but wrong date, or a chart note not signed, or wrong name on a receipt or something might just ultimately be the thing that sinks you in an audit, right? And here's the rub, like, these insurance companies are using massive AI machine learning models and like running these at scale for all the receipts, all the direct billing. They're running these things at scale through these massive AI language programs to try to pick up these sort of like inconsistencies. And those are the things that are triggering audits right now. And so we're at huge risk. Like, we all know AI is like moving at light speed. And so it is able to do so much more scale and volume when it comes to these audits. So at the end of the day, making sure that you're doing things as tightly as possible is essential. But we all make mistakes. Like, we're human beings. And even if we're all acting in good faith, like, we can't beat AI, right? Like, it's really important that we understand who is ultimately responsible. So, let's say, for example, you got a random audit and Manulife decides to come in and read all your clinician notes for the month of March, everybody across the board. Perhaps one of your clinicians just decided not to chart or left all their chart notes open that month, they're behind, whatever. That company might say, okay, great. So all 60 of these sessions actually didn't happen because this person didn't document, which, like, whatever. We should probably have a conversation around making sure that your staff are documenting and having consequences for not documenting. That's a separate video. However, if they decide that that session didn't happen and they ask for the money back, guess who they're asking the money back from? Not the clinician, the person who billed it. So that's where understanding the risk is absolutely essential. And in addition to that, if you do decide to direct bill, consulting a lawyer and having clauses in your contracts that create some form of recourse or discipline, or counter opportunity to recoup that money. Having these clauses in your contracts with your employees and your ICs is also really important, because in that case, let's say there was 60 sessions that didn't have notes, you billed for it, now you're financially responsible. If you have a good indemnity clause built into your contract with that clinician, you can now go after them for that money again. But if you do not have that in a contract, shoot, too bad, you're on the hook financially. And so, as the clinic owner, so if you are going to direct bill, again, something that really is necessary to have prepared and have included is these types of things addressed in your contracts. How are you going to handle this if the clinician makes an error and you are the one who has direct billed as the clinic owner on their behalf? So speaking to a lawyer to have these contracts drafted up, having policies and systems in place that protect the clinic owner. And, if they want to direct bill still, that's going to be the consequence of that. And so being really clear on understanding who is ultimately liable, but then if you do decide to move forward with it, making sure you have proper recourse built into your contracts, essential. Cool. That's number 3. Number 4. So the fourth thing you are really going to want to consider if you do decide to direct bill is, do you have the admin resources and accounts receivable capacity to do this, right? Do you actually have the time and the staff and the systems and, the bookkeeping software to like really follow up on all these accounts receivables if claims are denied or if they're pending? Because as much as we want to believe direct billing is a really simple thing and it's always approved and easy peasy and it's going to save us all these credit card fees, inevitably there are denials and sessions that get moved into pending. Or the other big one is like these weird dual coverage systems where people have double insurance and then you bill the wrong one first and you get like, it can get really messy. And so, yeah, for the 90% of the time that you do direct bill, it's going to be a simple approval, boom, boom, boom. But that like 5 or 10% of sessions that get rejected or are pending or have weird things built in, or the insurance company calls you and does a quick like check, like the amount of those that happen is going to be so small, but they're going to take up all of your time. Like 10% of these claims are going to take up like 80% of your admin and AR burden and, capacity. So do you really want that to take on so much of it, right? And like, yeah, saving on credit card fees is huge, but then what's going to happen is you're probably going to need to hire someone to be the money chaser downer, right? Like, so that 2 or 3% that you're saving in credit card fees now is going to translate into someone that you're probably paying a salary or hourly rate to track that money down, right? And like, talking about like ICBC, tracking that down, keeping track of like how many sessions people have done, how much coverage they have. Like, it's just a lot. It's a really big administrative burden. And so, it might seem like a really nice, smooth way to do it, but inevitably there's going to be challenges in tracking that money down and calling insurers and, those pending ones where you don't actually process the credit card until a week later when you get the result. And then, not even noticing if the money came in or not, and it just sits in your accounts. Like, it can be a nightmare. And so having really, really strong accounting and accounts receivable systems and administrative staff in place is really important if you are going to direct bill, because it's going to create a lot more administrative burden than, saving 2 or 3% in credit card fees is going to offset. So something really to think about there. And obviously, patients love it. Some of them even book clinics based on that. And so, by not offering direct billing, yeah, you might be cutting out a few people, but if you're really working on, strong service providership, it's not going to matter to people. They're still going to choose you because they're happy with the service they're getting. Direct billing truly is a bonus. It's not necessary. It's a nice bonus for people, but the responsibility is really a huge part that people are not really aware of, right? And how much work it is to track these things down. So anyway, number 4 was admin, resources, accounts receivable, capacity. Do you actually have it? How much time are you willing to dedicate to tracking all of this down? How much time are you willing to put into like creating all the correct consent forms and like staying updated on terms and conditions? Because we all know terms and conditions are constantly changing, and it's not like that information just falls into your lap. So staying up to date on all of these practices is really challenging, and it's a large administrative burden. So how much hair do you want to pull out? I'm not entirely sure. Depends on your administrative capacity. So the very last thing to consider before you choose to direct bill, after all of these wonderfully fun things that we've just discussed, the very last, well, it's not the last, there's plenty of other things to consider, but I think this one is really, really important. Number 5, the 5th thing you strongly want to consider before direct billing is, do you understand the audit terms for each of your insurers? What does that mean? When you enroll in a direct billing service provider network, you are agreeing to their terms. This is not a two-way negotiation. This is not like, oh, hey, Canada Life, I'm going to direct bill for you. Like, so here's the deal. Here's what I expect, and here's what you expect. Great. Shake hands, create a term. Absolutely not. You are agreeing to their terms. And as we've mentioned already, many of them don't make that easy to find, right? And so, many of them will claw back funds even after they've paid. Some insurance companies, once they've paid, a check paid is a check paid. And especially when it comes to clients. So if they've paid a client, they'll never ask for money back from a client. That is not true across the board. So understanding the audit terms on the clinic side and the patient side for each of these insurers is essential. How much money can they claw back? How far in the past can they go? For example, I know, I'm not sure if this is up-to-date information or not, but I do know that for a while, Pacific Blue Cross could audit back 3 years for a clinic owner, but only 1 year for a client who submitted. So if you direct billed, you were subject to audit up to 3 years in reverse. If you had the client pay and they submitted on their own, they were only subject to audit 1 year in prior to that. So that's actually a huge discrepancy, right? So regardless of the service that was provided, the client can only get audited back a year, whereas you can get audited up to 3 years. So, I mean, first of all, that doesn't seem entirely fair to me, but again, I'm not the business owner there. I'm not the person making the terms and conditions. So understanding each of these audit terms, can they just show up on your site? ICBC's new terms had some pretty gnarly pieces to them. Like, they could just show up on your site and access any devices, personal devices, whatnot, and any files. This, while they have changed their terms and conditions to say related to ICBC, same for other insurers. Do their terms and conditions say we can just show up on site? Do they say you need to produce it in X amount of time? So, if you get audited, do you have to produce those records within 10 days, 30 days, 90 days? What does that look like? How much time are you going to have to actually go through and compile everything if you do direct bill? And so understanding the difference and the terms within which you can be audited. Are you allowed to get a lawyer? Are you, what sorts of things can you do if you are audited, and what layers of protection do you have? Who is responsible? Really understanding these audit terms is really important because, everyone, when I first started direct billing, I was like, I'm fine. I'm following scope of practice. I'll never get audited. That's such a naive way of looking at it, right? Oh, it only happens to clinics that are doing things that are inappropriate, or oh, it only happens to clinics that are making mistakes. Oh, it only happens to other clinics. It'll never happen to me, until it does, right? And there were lots of clinics in the last couple of years that were doing things totally by the book, who still got some pretty big bills because these, insurer audit terms were not clear. The flip side of that is these insurance companies are also making it really challenging to find these terms and conditions. So something that I advocate for very strongly, especially in alignment with PABC and BC Physio, is transparency on this. This is super, super important. So I also encourage practitioners and clinic owners to rally around this and really encourage insurance providers to be ultra clear on this. If their scope of coverage is going to be different than our scope of practice, they need to make that clear. And they need to make their audit terms clear. How far back can they go? What do they expect? What does an audit look like? I really, I think audits are a good thing. Not every clinic is doing things in good faith. There are some bad actors out there, and there are some practices that are old and outdated and pulling the profession down. So I fully think an insurance company should be able to audit, because fraud makes us all look bad. Like, if we're not following, if I'm acting in good faith and someone else is not, then it brings the whole profession down. And as we fight this fight for increased fees and better visibility in the public in terms of what we offer, being these primary care providers that we really truly are, and trying to align ourselves more with physicians and nurse practitioners, we cannot have bad actors. And so, in fact, I love audits. I think they should happen. And yeah, occasionally there's going to be errors. There's absolutely going to be errors. But if you are acting in good faith and you know what you are doing is by the book, you are following scope of practice, you're an innovative, quality service delivery clinic, really considering these things is really important, because, at the end of the day, it's a lot of work and a lot of responsibility. And as we know, the margins of opening a clinic and owning a clinic and operating a clinic are really, really low. It's really challenging right now. And, that's a whole other conversation. And in my blog and on the PABC app, the whole conversation that I started in the piece I wrote about raising our fees talks about a lot of the reasons around this. And so getting audited and getting money back because of error, or because of, someone that you were direct billing on behalf of who made an error or maybe wasn't acting in good faith, can really hurt margins. It can absolutely swamp a clinic, right? Like, it can force someone to close. Like, horror stories do exist. And so, I don't want to fear everyone into submission around this, but I also feel like empowering yourself with knowledge and understanding these terms and audit conditions is really, really important, because feeling well prepared and putting strong systems in place to prevent audits is going to be really, really important. And by all means, continue to direct bill if you feel comfortable and feel strongly that everything you're doing is, by the book, and you're doing the right things, and you have all the systems in place, you have consent documented, you have, strong knowledge of these terms and conditions. go for it, do it, save that 2-3%, like put the systems in place. Maybe you have better accounting systems. Like I would love to know, do you find it challenging to track this money down? Is it worth it financially to direct bill? I would love to have a conversation going in terms of like, why do you direct bill? What are your reasons for it? What are the pros? What are the cons? I absolutely understand there's tons of pros to it: saving money, client retention, making their lives easier, being an excellent service provider. These things are really important, right? And so, I clearly have some strong feelings around it, perhaps because I was running a business that used PTSWs in good faith, and found myself in a position where direct billing just wasn't possible anymore because we couldn't be transparent, right? So I have many strong feelings around it, and perhaps yours are different, and perhaps your scenario is different. So it's a really challenging situation to provide quality care while also balancing, the feelings of making sure you're protecting yourself and your business. So it's something to weigh. So with that, I would love to kind of get some engagement around this. I want to know your feelings on it. Do you feel as strongly about the risks as I do, or do you feel like it's actually worth it? I would love to hear. So, it's do the rewards outweigh the risks for you? So yeah, I'm really curious. I appreciate your feedback and your thoughts on it. Are you going to keep direct billing? Like, how do you feel on this? I would love to know. Engage in the comments, shoot me a DM. I'm always available. I would love to chat more. Like if you actually are trying to make a decision around whether to direct bill or not, or to perhaps opt out of direct billing, this is totally in my consulting wheelhouse. And I would love to have a conversation with you about whether it's actually appropriate for your situation or not. So please reach out. My website is danielleboyd.ca, and I would absolutely love to engage in a conversation with you. Thank you so much for listening, and we'll see you soon.